I welcome the Royal College of Physicians' call for more research in NHS trusts. I have worked throughout my professional life to increase the amount of patient-facing, patient-based research, from experimental medicine through clinical trials to public health, complex interventions to prevent disease. We need much more research. The benefits of research in the NHS are absolutely clear. We've had a recent publication last year which emphasised that the more patients you put into clinical trials, the better the patient outcomes, the lower the mortality, and actually the better scores with the Care Quality Commission questionnaires.
I think we should give ample opportunity to physicians who want to do research, not only consultants, but also junior doctors. At the end of the day, funding is going to be an issue, but we will fight to find some space and to find some room for them, to have some PAs available to do clinical research or any other research they think which is going to improve their work and going to improve the quality of care in NHS hospitals.
I think it's important that research is recognised at board level, that the metrics, the volume of research and the specialties in which it's undertaken is visible to the whole board, the executive directors, the non-executive directors, and for foundation trusts, the public. It's key to making things better for both patients, but also for the NHS.
NHS trusts need to ensure that research takes place by doing a couple of things. They need to make sure that staff have got time to do it, and they need to make sure that patients know that it's available. Those are the key things.
Particularly perhaps for patients who are suffering from an illness that they don't really understand, it may enable them to get a deeper knowledge about what's the matter with them, because they get a lot of information and because they have access to people who have a little bit of time to spend explaining things to them that they may not get in an ordinary clinic or on a ward.
We know that many doctors find research to be a very positive experience. But the problem is the challenge of finding time to do research. So the college wants to make a very clear but emphatic statement that facilitation of research in NHS trusts is part of core activity.